Hi, it's Carl Lishing, an independent insurance agent based out of Lakewood, Ohio. 25 plus years experience working in this industry. And today we're going to talk about individual health insurance and what options are available to people that need to buy their own. There's four main kinds. First and foremost, there's plans that comply with the Affordable Care Act rules and regulations. Technically, the law is called the Patient Protection and Affordable Care Act. In the industry, we often call this ACA qualified health plans for short. Now, on the patient protection components of the Affordable Care Act, these plans have to cover pre-existing conditions. Mental health, substance abuse, maternity is built into it. Individual health plans prior to the Patient Protection and Affordable Care Act coming along weren't too strong in those departments, but it also covers everything, the other things that we are accustomed to having health insurance cover, like hospital stays, doctors, specialists, prescriptions, durable medical equipment. So they increased the coverage standards. Now there's good intent with that, but it also costs money to do that. So the individual health plans went from here up to here due to those coverage enhancement requirements. Now, if people qualify for federal tax credits, sometimes called subsidies, through the marketplace, it's based on household size and income as it pertains to the tax return. So if it's an individual making $30,000 a year, they're probably going to be eligible for subsidies. If they're making $250,000 a year, probably not. Now, if it's a married couple, they have to file joint to be eligible for these federal tax credits or subsidies. And it works on a sliding scale depending on where the income is. It used to cap out at 400% of the federal poverty level, but in response to COVID, there was some legislation passed called the American Rescue Plan Act. They got rid of that 400% threshold, and there's no high-end cap. The way it works when the marketplace is determining subsidy eligibility, how much money people get to help them buy health insurance, it's really, there's bronze, silver, gold. At the silver level, the second lowest cost silver plan is what's called the benchmark plan. The subsidies kick in to keep the cost of that plan under a certain percentage of their income, depending on the household size and how many people they're insuring. So it kind of depends. If the person's getting a decent amount of subsidy, the Affordable Care Act can live up to its name. If there's not much subsidy there, it can start to become debatable about how affordable the Affordable Care Act is. They tend to have higher deductibles and higher maximum out-of-pocket spending limits than most people are accustomed to that have had commercial insurance through jobs in the past. So that's one option. It's good for people that need to cover pre-existing conditions, or they're getting enough subsidies to make the Affordable Care Act live up to its name. Now, alternatives to the ACA, I think short-term medical can be a decent, viable option for some. Unfortunately, healthcare is involved in politics to some degree. So currently in the state of Ohio, people can keep short-term medical for up to 12 months. This is going to be a state-by-state thing. Other states allow for longer periods of time. Some states don't even have short-term medical. Now, the way short-term works for the most part is when you apply, they ask questions to determine eligibility. So they're underwriting it. A lot of them don't cover pre-existing conditions or maternity, mental health, maybe not so much. There are some exceptions to that. I'm aware of one company that if they take the member on short-term, they do cover pre-existing. They do cover mental health and substance abuse. They do cover maternity, but that's kind of a little bit of an uncommon thing. Most of them don't do those things. Now, the advantage to short-term, because it's underwritten and they're selecting healthier risk and it doesn't cover pre-existing maternity, mental health, substance abuse, is the price points are a lot lower than the ACA compliant health plans without subsidies. So even though there could be enough of a premium savings to make it worthwhile, even though it might not pay for their preventative care and their annual exams, if they're saving $500 a month, with the money that they're saving over the course of the year, they can pay that stuff out of pocket and still end up ahead. Now, thought on short term. For it to be a decent alternative, I try to get my clients working on short-term renewal dates of either January 1st or February 1st. So the ACA plans that have to cover pre-existing conditions, open enrollment for that is November 1st to December 15th for plans to start on January 1st, and then from December 16th to January 15th to start on February 1st. So if somebody buys a short-term plan, we want to try to get it to renew on January 1st or February 1st and get it working around that 12-month window of time. So if they're on short-term and they're diagnosed with a health condition, it's going to cover it as long as it's not pre-existing. Now that short-term plan is going to run out. And then when it goes to renew, they're subject to underwriting and they might not get approved or it might not cover pre-existing. So we want to have the timing set up around when open enrollment is for the ACA plans. So if they need to exit short-term and get on a plan that will cover pre-existing conditions for the following year, we've got that option to have a backup. Otherwise, if the person's in fairly good health and it stays that way, just reapply for short-term year after year, as long as this is a viable option. But with the regulatory environment and government rules and regulations, things are subject to change. A third type of health insurance that's available is what are called sharing ministry plans. They're usually sponsored by faith-based organizations. These are not insurance products, so they're not regulated by any government agencies. There's no reinsurance requirements. They're self-running, and people are paying into it like you do for health insurance. It goes into a fund, and then they're sharing claims for other people in need when claims come in. There's no guarantees on these products. If one goes belly up, there's no recourse. So a lot of them perform pretty well. Some of them perform better than others. We personally don't carry those products in our agency anymore, just because there's some concerns that if one goes belly up and there's no backup plans, is that going to create liability issues for us as an agency? But those kind of products are out there. Another type of individual health product is what are called indemnity products or indemnity plans. They pay out up to certain amounts. I don't write a lot of these. We have them in our product portfolio. I've run across people that have had these products misrepresented to them when they fill out an online form and they start getting blown up with all kinds of phone calls to get quotes from all over the country. Sometimes they come up with a little bit of sales pressure where people are being told any doctor, any hospital, no deductibles. Sometimes they're told that they have to sign up by a certain time to secure this rate. I'm not crazy about some of the sales practices that I've heard on those things. And in the product itself, there's no deductibles and pays at 100%. But what sometimes people don't go over is what the limits are. So like if you end up in the hospital, it might pay at 100% with no deductible, but maybe there's a limit of $500 or $1,000 a day. So if you have $10,000 in billed charges, the rest of it's going to come back to you. So indemnity plans, they're out there. I usually think that there's better options with either short-term or the ACA compliant plans. So a little bit of a high-level overview. If you'd like to learn more about these things, feel free to call us or use the scheduling link to book an appointment. Thanks for your time. Bye for now.